Solubility of organic medicinal agents. Importance of solubility. Formulation of the drug is an appropriate dosage form and biodisposition. Disposition of OMS in the living system after administration, absorption, distribution, metabolism, and excretion. ADME. The solubility expression in terms of its affinity, philicity, or repulsion, or phobicity. Either in aqueous or lipid solvents are hydrophilic, water-loving, lipophobic, lipid-hating, then lipophilic, lipid-loving, and hydrophobic, water-hating. Solubility. Majority of the OMS possess balanced solubility, that is, they should have some solubility in aqueous and some solubility in the lipid media. It is because of that OMA, that is, these medicines should move through the aqueous, both aqueous, that is plasma, extracellular fluid, and lipid media, biological membranes inside the cells. The most important intermolecular attractive forces are involved in the solubilization process are van der Waals attraction, the weakest molecular attraction, and dipole-dipole bonding, which is a little bit stronger than the van der Waals attraction, and then ionic bonding, which is more stronger than the previous two, relatively strong, 5 kilocalories per mole. And ionic dipole bonding, which is electrostatic between a cation, an ion, and a dipole. Acidity and basicity. Acidic or basic properties OMS are important in both pharmacological phases. In these two phases, the three aspects of acid-base chemistry are definition, recognition of acidity or basicity, basic organic functional groups, and estimation of the relative acid and basic strength of these groups. In the pharmaceutical phase and pharmacological phases, this acidity is very important because of that the acidity and the basicity of the target molecule or target medium is also very important. Depending upon the target medium, their acidity and basicity is playing very important roles. An acid is a compound containing functional group that can donate proton, and a base is an organic compound that contains a functional group which can accept H+. Recognition of acidity or basic organic functional groups. Common organic functional groups: carboxylic, phenol, sulfonamide, imide, carboxyl, and these are the common organic functional groups, acidic functional groups, which is present in most of the drugs. And some of basic organic functional groups are aliphatic, heterocyclic amines, and the different kinds of amines. Estimation of the relative acid-base strength. These are the estimation of the acid-base strength, relative acid-base strength, which is important for the drugs medium. And one of the very important properties is buffer. Buffer is a solution that resists change in their pH, acts as acid or base, is aided. These buffers are acidic. Some buffers are acidic, some buffers are basic buffers, alkaline buffers, which when all the buffers, if they add little amount of acid or a base, the pH cannot be changed too much. That's what it plays very important role in the human living system. Polyprotic acid. These are the acid which is present mainly in the human and living bodies, which plays a very important part because of that when it loses one acidity and it functions as one part of acidic function and the other is the other is a basic part. That means it can have function as buffers. That's why polyprotic acids are very plays a very important part in the living body. Drug-receptor interaction. Receptor is the site in the biological system where the drug exerts its characteristic effects, or where the drug acts. The place where the drug is acting on is the receptor. Receptors have an important regulatory function in target organ or tissue. Most drugs act by combining with receptor in the biological system. Specific drugs. These are the drugs which have some specific receptor. Structural feature of drugs and their pharmacological activity. The structure, the stereochemistry plays a very important role in the activity of drugs. Because of that, the stereochemistry, which can be easily fit into the receptor. That's what the stereochemistry plays a very important role. Any change in the stereospecificity of the drugs will affect its pharmacological activity. The isomeric pairs have different physical properties and thus differ in pharmacological activity. These are the stereochemistry factors: optical and geometrical isomerism, conformational isomerism, and isosterism and bioisosterisms. Thank you.